So we're glad that you're here. We are recording this session. We will be posting it, just to be aware. And if you have questions, please feel free to raise your hand, put something in the chat, and we will be taking questions at the end of the sessions. And we also, in this session, just so that you're aware, with a series of questions that we almost always get. So we may even be able to answer your question at the end. Next slide. Again, our objectives there, we want you to understand the role of the FPQC in supporting hospitals and improving perinatal quality of care. We want to make you aware and make sure you understand the new Florida statute about FPQC participation. We'll be reviewing 2 current initiatives that relate to that statute. One is this new Social Determinants of Health initiative, and the other is our Perinatal Quality Indicator initiative. And then we want you to understand the benefits of actually joining collaborative and what are you really gaining out of this. Next slide. Just so that you know, here at FPQC, our vision is that all of Florida's mothers, infants, and families have the best health outcomes possible through receiving respectful, equitable, high-quality, evidence-based perinatal care. Although there is a state statute, your participation, how you participate, what you do within your hospital is voluntary. We are very data-driven because what gets measured gets done. We're population-based. We want to include everybody. We are evidence-based, equity-centered, and the idea that we want to remove any disparities that are out there in what we do, and we want to be a value add to the family, to the hospital and the staff, and to the state. Next slide. We couldn't do what we do without all of our partners and funders. Just so that you know, we are a statewide partnership. We have a collaborative because of our statewide partners. They participate in every level as possible, from funding all the way to actively helping us lead initiatives. And we are very thankful for our partners. Next slide. Just to help you, let you know what's happening on the nationally and within the state related to quality improvement in the perinatal area for both moms and babies. This last year, unsolicited by us at the FPQC or by the Florida Department of Health, the legislature decided to write into state statute that all Florida maternity hospitals are required to participate in 2 FPQC quality initiatives at all times. And right next to it is the Florida statute. You can look at it online. So we're trying to educate and help make you all to choose what you want to work on and what that looks like for your hospital. Also, CMS is now requiring all hospitals that participate in Medicare to report whether they are participating in a national or state quality collaborative, and are they implementing their bundles. And right now you're just reporting yes or no, but tighter requirements are expected in the near future, and there's a lot of national discussion about what that should be. The third thing is the Joint Commission is now accrediting hospitals. They must select one quality improvement health equity issue and present a series of QI steps performed to address the issue. We bring this up because our quality initiatives actually will meet this Joint Commission requirement for you if that's an interest to your hospital. So improving quality is very important, and more people really want to have hospitals and providers engaged in this effort. Next slide. Again, we offer a variety of initiatives at one time. We have our postpartum access and continuity of care that started in the fall. We have 76 hospitals working with us there. We're planning our social determinants. It's coming up. Our kickoff for hospitals is going to be April 26th here in Orlando. We are wrapping up our infant health initiative on paired or family-centered care that's focused on skin-to-skin care. And we're in the process now of developing our new infant initiative on NICU discharge and transition to home, which will also have a social determinants of health component to it. We have our perinatal indicator project you'll hear more about, and we twice a year offer birth certificate training, trying to improve the quality of the data is collected so the information you're using is benefit to your patients. Next slide. So why would you want to participate in an FPQC initiative? First, it gives you a turnkey quality initiative that you can work on. We at no charge provide you a background, change package, rapid data reporting, training, education, materials, coaching, mentoring, and sharing. It's all there. What we offer to you are all evidence-based guidelines, research, best practices, and we provide immediate access into national consultation so that what you are doing with quality always relates to the cutting edge. Just as you know, I'm multi-hospital quality initiative, and why all these new guidelines and regs are coming out is because if you're in a multi-hospital initiative, you will promote earlier, larger, and more sustainable quality improvement. So by participating with us, you'll gain more than you would on your own. It promotes networking among clinicians and around the state on major practice and treatment issues. For you and your hospital, it provides publication, presentation, education, and leadership opportunities. It promotes state and community system change through our quality initiatives. We've actually helped enhance the system of what we provide to moms and infants. And then it now meets a new state requirement. Next slide. So again, what do we offer you in an initiative? We'll give you an online toolbox that has algorithms and sample protocols and education materials and competencies. And right next to it, we give you coaching calls to help you with implementing that on a regular basis and learning from your other hospitals. We'll provide educational sessions, videos, and resources. We'll have statewide meetings to help you learn from each other and gain information and ideas. We provide rapid data reporting on a monthly and quarterly basis. We'll send out regular emails to update you on the initiative, but also the latest information that's coming out. We'll provide technical assistance that's needed to you, as well as personalized consultation, grand rounds, and others. It's all part of a package that comes to you at no cost. Next slide. So with this, I turn it over to our outstanding nurse consultant, Margie Boyer.
Thank you, Bill. Can everyone hear me okay?
Yes, ma'am.
All righty. So as you can see for this infographic, the social determinants of health that we are covering, all the key social determinants of health. So we're looking at housing. We're asking about, are they having an issue paying utilities? Food insecurity. Do they have any issues with getting food for themselves or for their baby? Transportation, any issues getting to and from their doctor appointments? And that whole community resources out there. And also already asking about intimate partner violence as well. So that's the whole social determinants of health. And FPQC, we want to again thank the Florida Department of Health, also AIM and the CDC. Next slide. And here is our leadership team, our provider leads, Jessica Brumley, our nurse midwife, and then we also have OBGYN, Dr. Karen Harris. And I am the nurse lead. On our QI team, we have a fabulous QI team led by Nicole Pellegrini, Stephanie Rees, and Shaniri Reed. Data team, you'll be seeing also today, Dr. Stephanie Rubio and Benjamin Gessner. So that's our team. And next slide. I will hand this back over.
Hi. Thank you, Margie, for that wonderful introduction. I don't think Dr. Harris has been able to join us. And so I'll go ahead and review this. So we always start with the why, right? And this helps us to understand some of the why we're choosing to work on this initiative at this time. You can see from this that a review of postpartum discharge pregnancy-related mortality rates between 2015 and 2019 in the state of Florida. But there are significant disparities in these outcomes based on social determinants of health, including insurance coverage and race and ethnicity in particular. And so we're hoping that this initiative starts the process of changing some of our culture in healthcare to be able to promote more equitable outcomes. Next slide. So the global aim of the Social Determinants of Health initiative is to improve maternal health by transforming hospital culture and environments to respectfully serve all mothers and their families by helping them meet needs related to social determinants of health. The two aims that we have in specific are to achieve a 20% increase from baseline in the percent of patients with a positive social determinants of health screen who were referred to appropriate services. So not only do we want all of our patients screened for their needs, but also we want them to be able to understand the services that are available in their community and how to access them. We also have the aim of having 80% of providers and nurses attend a respectful maternity care training program sometime between January 2023 through December 2024. The primary drivers of these aims include improving our data collection, such as maternal characteristics, risk factors, and outcomes across social determinants of health. As Dr. Sappenfield mentioned, we are data driven, and if we don't have accurate data, then it's really hard to indicate, number one, where the problems are, and two, if we're impacting change. Also, respectful maternity care is one of our key drivers, universal social determinants of health screening and linkage to services, and then family and community engagement in QI work. And this is something we've been working really hard to make standard in all of our work. How are we engaging our families and our communities in this work? So it's really meeting the needs of the people that we're serving. Next slide. I think Stefania was going to present this.
Thank you, Jessica. So you've seen our theory of change in the key driver diagram. You can see what we want to base our initiative on. And then we're going to focus on each one of the primary key drivers. So the first one is data insights. Here, we need to learn about the mothers we serve, right? Their characteristics, risk factors, and outcomes across social determinants, so we can actually give them the best care possible. We all know that different groups of people have different healthcare needs, so we need to understand these differences to tailor services accordingly. We also understand that when hospitals know the population they serve, healthcare providers develop culturally competent care and communication strategies that resonate with their patients, so patients remain engaged with their healthcare, and in turn, they have better outcomes. Through data, we can also identify health disparities and take action to address them. So in your secondary drivers, you can see that we are going to be focusing on improving the collection of individual patient characteristics and SDOH data. Here, we need to make sure that the data is accurate. So when we identify the special groups that may need additional help, it actually reflects the population characteristics. We need to have a system in place where if there is mistakes, the system is able to correct it. And we need to make sure that the patient is the one that is reporting this data, right? Self-reported patient data is very, very important. So we're going to be focusing on making sure that is happening across the state. And the secondary driver, you can see it. We're going to use PQI. Many of you are already part of the Perinatal Quality Indicator Report. One of the new components is the SDOH dashboard, which is going to help identify disparities. We're going to ask you to share those findings and build ongoing plans to address those identified gaps. And so this aligns very well with what the Joint Commission is asking for accreditation, but also really does a full circle, right? We will work on improving individual patient data. We will analyze it, identify disparities, and then we will use it to make informed decisions and plans to address those identified gaps. Next slide.
So as you can see on the bottom of many of these slides, we have respectful care as a universal component of every driver and activity. And so it should be, I think, no surprise that we made the decision to make respectful maternity care a key driver in this work. So we are working to learn, define, commit, and implement respectful care for mothers, and to learn over time how well you're performing. And so how can you do that? One is to educate your providers and staff about respectful maternity care and its components and strategies. I have no doubt that everyone on your team aims to provide respectful care every day. But we all know that with additional training and support, that the care that we provide improves. And so we will be offering respectful maternity care education programs, but there are many also that are available. And so we'll also provide guidelines on what you should be looking for in those programs that are already available to you. We'll also develop a hospital commitment with providers and staff support. And so part of our toolkit will include a commitment form that indicates what individuals can do in hospitals to provide respectful maternity care. And then implementing and using an ongoing respectful maternity care survey and other methods of maternal feedback to improve care. So many of us are accustomed to surveying our patients on how satisfied they are with their care, but this will be very distinct from the sort of Press-Ganey type surveys that many hospitals implement, and looking at key components of respectful care and how your patients are experiencing that. And then there'll also be an opportunity for sort of qualitative interviews where we'll be partnering with Healthy Start to help provide hospitals feedback on, in a qualitative fashion, in patients' own voices, the experiences that they're having in our institutions. Next slide.
Okay, for the next primary key driver, I'm on a work group with Dr. Karen Harris. I understand she's on by phone. Do you want to cover this one, Karen? I'm not sure if she's going to be able to. She and Linda Detman and I are on this with her. So I'll go ahead and cover this one. So this primary key driver, as you can see, is all around universal social determinant of health screening and linkage to services and resources. So what we want to see is that hospitals are screening all mothers for those key components for social determinants of health, and then assist and refer them to help to meet the needs in a successful and respectful way, working with our community partners. So as you can see, these secondary drivers, we're going to be screening all of our mothers in a standardized format. And then once we see that someone needs some assistance, we want to be able to link those patients to identified community resources focused all around these social determinants of health. We're looking at developing these community resource directories and other referrals for the hospitals to use. Next, we want to also educate hospital staff on processes for developing a mutually agreed upon plan of care, utilizing that shared decision-making model. So we want to make sure all hospital clinicians are really familiar with shared decision-making and how that works. Next slide. And I'll hand this over to Jane, right?
You're on mute, Jane.
My apologies. Thank you, Margie. We are going to be leading a group, John & Johnson from Healthy Start, who's also a consumer, and I are going to be leading a group to ask mothers and also other family members to represent and define some of the work that we're doing to look at what they determined was respectful, what community resources that they would like. Our key driver is to include family and community representatives in defining and implementing their hospital QI initiative. We've already got a group together. We're going to be meeting in the next couple of weeks, and excited to have the perspective of the consumer. Our secondary driver is to educate the QI team, the leadership, providers, and staff about family and community advisor involvement. I think they're going to give a really rich voice and have a different perspective than sometimes that we may have. So this is great for us. And we'll be engaging family and or community advisors to provide ongoing input on QI efforts and care provision. So we're excited about this and we're moving forward.
I'd like to add, if I can, we really do believe that having both community and patient input into this quality initiative is essential. You cannot talk about respectful care and addressing patient needs without having that involvement. And if you apply, we're going to strongly recommend that your hospital have a patient advisor and a community advisor on your own hospital team to help you think through what this is. John is our patient advisor and Jane is our community advisor, and we're modeling that same process. I just want you to know that FPQC really believes in this concept, and this is what's really going to be necessary to help anchor us in improving quality. Thank you, Jane and Jonna.
Next slide. Okay, so this is our timeline for social determinants of health. Right now, we're in that hospital recruitment phase from February through April of 2023. Our statewide kickoff will be on April 26th, and we'll give the next slide gives you a little more information about that. But during this time between February and June, you're all going to be doing some baseline data collection. You're going to be recruiting your leadership team, and again, communicating to everyone that that statewide initiative kickoff is April 26th. And moving on, hospitals, we will have you all do your individual hospital kickoffs in July of 2023. And then moving along, we will be doing the same coaching calls that we're doing now with PAC. If you're on PAC, you're familiar with that. We'll have monthly learning sessions, ongoing data collection. We can have technical assistance visits with you all, and those ongoing monthly coaching calls with our groups. And then in the spring of 2024 is when we will have our mid-initiative meeting, and the entire initiative concludes in December of 2024. Next slide. So here, mark your calendars. We will have an in-person. We do require that hospitals participate in the in-person kickoff meeting, and that will be held Wednesday, April 26th at the Advent Health Nicholson Center, where we also had held the PAC kickoff, which is a lovely, very nice location to have a kickoff. And you want to go ahead and have your team save that date if you plan to participate. So go ahead and mark your calendars. Next slide. Again, emphasizing the deadline to submit your application is March 15th. So you want to go ahead, here's how you apply. There's the link right there for you. And please reach out to fpqc@usf.edu if you have any questions at all. We are more than happy to assist you. Next slide. And Estefania.
Thank you, Margie. So there is two reasons why we are presenting the perinatal quality indicators to you today. One, it's one of our initiatives that you can join, and it's going to meet your state statute of participation with FPQC, but also because, as I mentioned in the data insights, you're going to need access to the PQI report to identify those gaps, to compare yourself to others and see where you really have an opportunity for improvement. And so what's PQI? It's a report that we produce twice a year in a paper form, but you can access to it at least 4 times a year. It gets updated 4 times a year if you access online. So we are really going to push for online access because it will give you additional features that the static paper form doesn't. You will be able to disaggregate your data. You will be able to do a lot of things additional in the online system. And so far we have 85 hospitals that are part of the PQI report. So maybe your hospital is already part of it. If it is, you need to identify who is the liaison, and hopefully they will be part of the initiative. Otherwise, we will add another person that can access the PQI report. But if your hospital is not, we will really prompt you to apply, because that way you can access, the dashboard that you will need for SDOH. There is no charge to participate as with other initiatives. You don't need to submit any data for the PQI report. We get all the data from birth certificate data, from inpatient hospital discharge data, so you don't need to submit any data. And it's very easy to enroll. It's ongoing. So whenever you're ready, you enroll, and we will give you an account, and you will be able to access all your reports. Next slide, please. We conduct research on the perinatal indicators frequently to make sure that we are providing the best information available, and that the indicators that we provide to you are accurate and have validity. So these are just some examples of previous research that FPQC has published on certain indicators. Next slide. Within the report, you're going to have a PQI summary dashboard where you can quickly see how your hospital is performing compared to other hospitals in the state, right? So here in the black bar is the hospital percent, and they can quickly see if in which quartile the hospital is. So either the first, the second, the third, the fourth. They can quickly see if they are among the best rates in the state or among the worst rates in the state. They can also see their data quality issues. You can see the flags there for agreement and unknown. So if you have any issues with your data, this is a place that you can quickly grasp how you can improve on the quality of the data. And then you can also disaggregate, as I mentioned, for NICU level, if you only want to compare yourself with hospitals with comparable resources. You can disaggregate by patient characteristics for race, ethnicity, and payer. Next slide. Once you identified an issue, you can go into the indicator itself, and you're going to see a time trend where you can see if you have improved or you have gotten worse, right, over time. And this is very valuable because, as you can see, this is one of our example hospitals. They had a low NTSB cesarean rate in 2019 and 2020 when they were focusing on the issue, but the rate went up once COVID hit and made just things very, very difficult for everybody. And also, they had different priorities. Again, here, the hospital would be able to look at race, ethnicity, payer, the data quality, and compare themselves to same NICU levels. Next slide. For some of our measures, like for example, severe maternal morbidity, which is a composite measure, we will give you additional information so you can see which condition actually is giving you issues. So, for this example, we see that this hospital has high rates of hysterectomy compared to others. So, you will have additional information to dive in deeper and see where your hospital needs to work on. Next slide. This is something that will help for SDOH. This is the hospital profile. It will tell you, compared to the Florida average, the composition of the patients that you serve. So you have here just an example for maternal race, ethnicity, payer, maternal age, but we have many, many more. And so this is some of the work that you will have to start to do, identify which populations you are serving more and, which may have worse outcomes than others. In PQI, we are currently adding an SDOH dashboard, so you can see all key 9 perinatal indicators in one page, stratified or disaggregated by certain patient characteristics, like for example, race, ethnicity, education, payer source. And so the idea is that you can quickly see where you have gaps. And once you identify them, you can go deeper and see time trends for all the patient characteristics. And so that is something that we are working and building on, and we will launch it once the initiative is launched. So again, this is very important that if you plan on joining SDOH, which we really hope you do, you have in mind that you will also join PQI so you can access this aspect of the initiative. Next slide. All right, we're going back to frequently asked questions. Is that you, Margie?
Nope, it's me.
Oh,
Hi,
Linda.
everyone.
Sorry.
Hi, I'm Linda Detman, Associate Director for Programs and Operations with FPQC. I see people are already putting questions into the chat, which is terrific. I'm going to preempt, hopefully, some of them with some of the frequently asked questions. So next slide, please. So is there a cost to you as a hospital to participate in any of our initiatives? And the answer is no. Other than with PQI, there's some sweat equity involved. You have to do some training, and we ask you to do surveys once a year. And certainly participating in any of the QI initiatives is going to require work on the part of your hospital. But will you be having to pay anything to do that? No. So we do, however, for our kickoff meeting, we'll likely ask for a small fee to cover some of the food and beverage costs. All the work that FPQC does is supported by contracts and grants through our Florida Department of Health, the CDC, and the Alliance for Innovation on Maternal Health, AIM. We also do get support from professional organizations across the state, which we are greatly appreciative of. Next slide. So how many champions do you need to participate in an initiative? Now, I know we have many hospitals represented on the call who participated with us before and some who may be brand new. So we typically would encourage you to have as many people be part of your leadership team as can fill out the specific team members that we ask you for. So you, at a minimum, you need 3 people to participate, but there are about 5 different roles. So there's an initiative lead, a provider or physician champion, a nurse champion, a data lead, and a hospital administrator. One person could fill more than one of those roles, but it really is to your advantage to have multiple people in your hospital be a part of your initiative to help carry the load of the work. We also strongly encourage you to include other hospital personnel such as case managers, social workers, navigators, those sorts of individuals. And we strongly recommend, as we've already mentioned, that you include a patient or community representatives as part of your QI initiative team. Next slide. So who should be the initiative lead? This is really somebody who has the influence and the ability to drive change, to convene people, to provide oversight, and to ensure that the work that you're taking on to be a part of the initiative can be accomplished, and that can make the commitment on behalf of the hospital. So really you're looking for someone who can lead and assure that the work gets completed. Next slide. Who from the participating hospital is required to attend the initiative in-person meeting? So we need to have at least 2 people from the team attend our in-person meeting, so you're able to bring back the information to others on your team and to others in the hospital. If we have enough space, we can allow you to have more than 2 people attend the meeting, and we will let you know about that as we get the registration site set up and have those additional details. Next slide. So how will you submit data and how will it be protected? So we'll spend an entire webinar after the kickoff talking with you and your data leads about the ins and outs and particulars of submitting data. But just so you know, we are very much committed to securing and assuring that your data is protected when you submit it to us. We use a secure HIPAA compliant online data portal using REDCap for you to submit your initiative data. We will ask each hospital to sign a data use agreement that explicitly describes how the data is protected, used, and kept confidential. And just so you know, because we get this every initiative, we do not need a business associate agreement for you to participate. We, as FPQC, are not a vendor and we're not providing services to your hospital. So you don't need to worry about that, but you will need to have a data use agreement. And once you sign up, we will get additional information to you about that. Next slide. And then we're often asked, do we have to, as a hospital, go through an IRB review to participate? So for you will have to just find out from your own hospital if that's required. FPQC, we always submit an IRB to our own institution, to the University of South Florida. Quality improvement initiatives are 99% of the time determined to be exempt from IRB and not require oversight. And then we're always able to provide that documentation to you if you need to provide it to your hospital. And I think that's the end of questions. Go to the next slide. So now it's time for your questions. I know there's questions in the chat, but you can also feel free to come off mute and ask a question. Let's see, what do we have? Anything in particular that we need to address? I think some people have been answering questions as we've been going along. So let's see what we have. Yes, we're sending out the slides. If we attended original kickoff in October, we also need to attend. So October was for the PAC initiative. This is a separate initiative. We do a kickoff for each initiative first. So for the Social Determinants of Health initiative, you will need to attend the kickoff in April. If we decide not to participate in the initiative, can we still participate in the Respectful Maternity Care Train the Trainer? We will be providing lots of links to resources on the initiative webpage that would allow you to access those kinds of training resources. And
Also to add to that, Linda, if there is by chance space available when we're offering in your region, we may offer you that opportunity if you let us know, but it would only be if space is available, because we certainly want to serve those in the initiative first.
see, there's a question about, will the initiative have only hospital level data, or will there be patient level data as well?
That's a great question, Tracy. We're finalizing those, details. So far, we know for sure that we are going to be asking for hospital level data. So things as structural measures to build your capacity, guidelines and policies, education, and things like that at the hospital level. The patient level, we are finalizing. We're wanting to make sure that what we are going to collect actually has significance. So we will give you more details a little later. Sorry not to have a definite answer at the moment.
Related to that, earlier there was a question, can we have more training on how to access the data online?
We are planning to provide a couple of trainings. One of them will be about May or June. It will definitely be so you can access your reports. If you want to have a one-on-one with us, we're always available. Send us an email. We can set up an appointment and we will walk you through how to access, because I know a lot of people have issues with access. But if you want to learn more on how to utilize the report, we're going to host a session on May or June where we will show you how to get those insights, how to get those data bits that will help you support SDOH and other initiatives.
You also, when you apply, you'll be giving us a PQI lead person who does your social determinants, and we will definitely work with those people early on to get them on board and make sure that they can. So you'll have that opportunity to designate who that is.
Other questions? Anyone want to come off of mute and ask a question?
Yes, hi. This is Nell from Bethesda. For the PQI, I know I have an access online. When you say quarterly, can I go? What's a quarterly drop off? Is it like March or April, then July? How?
Yeah, the last set of sorry, Nell, thank you. The last set of reports were sent out in December, so the next update would be March or April. Okay. Most likely March. We are, we have to wait until the state sent us the data, so sometimes the deadlines are a little blurry. But hopefully by March you will get the next update. And we always send an email before, so you can all, access promptly.
Okay. I have a second question. This is for PACC for the PAC initiative. I know I haven't done my January. I have a question for the submission. Is it for the January delivery, right?
Yes.
Yeah, not the discharges for January, the delivery, my delivery for January. Okay,
that's
just want to make sure. Thank you. Thank you so much.
Just so that you understand, we do send out paper reports and hospitals can choose that. With our new social determinants, so we're going to now have so many different ways you can look at your data. There's no way to put in a paper report because you would never look at that many graphs if we gave you all the possible graphs. So if you're really interested in social determinants, we're going to strongly recommend that you get somebody who's willing to get online, because your data is protected information. We need to have you get within the USF firewall. So you have to have a USF email account and be able to have a secure password. And just like with your data being confidential for patients, we treat our hospital data the same way. And that's why we have those security steps that are there. But once you're in, It's easy to do.
Other questions?
Again, our real hope here is that we can use this as an opportunity to help address on the major issue of trying to address social determinants and respectful care. We're taking this on specifically because to do this as part of a larger initiative is just too much. And so we're using this as your opportunity to create a core base, because any future initiatives where we try to further address disparities, we'll be going back to these pieces, because this is going to be a core piece of anything you do to try and address disparities within your hospital.
For the patient advisor or community advisor, what's your take on that? I mean, who do you think, where do we get that?
That's a good question. I mean, one of the people we're going to be partnering with on this initiative, we have a special grant, is your local Healthy Start Coalition. I don't know what your relationship with them will be, but we're going to be contracting with them to help you all enhance your referral source for social determinants, because part of social determinants is not only screening, but getting families the care that they need. And so an easy one that hospitals could use is you could reach out to your local Healthy Start Coalition and have them be part, since you're going to be working with them already. In terms of encouraging patients in your quality pieces, many of you have patient volunteers. We would just encourage you to find someone who you think could add a patient perspective. If you're not aware, having a patient in the room when your hospital QI team meets changes the whole dynamic of the team. And when you start talking about patients, it reminds you who you're talking to and getting their input into your thoughts of what that is. We're voluntary. So however you choose to adopt that and adapt that to your hospital, you know what's best in your environment. We're just saying that input clearly from a quality improvement perspective, and the literature is showing it, really makes a difference.
Okay.
Does that make sense?
Yeah, thank you, Dr. Bill.
Seems like there's no other questions. We can go to the next slide, please. We're just reminding you, of course, that the application deadline is March 15th, the Ides of March. You can see the link to apply. Again, if you have questions about applying, if you have questions about anything related to FPQC, you can always reach us at fpqc@usf.edu, and we will do our best to be prompt in getting back to you.
And this link to the application is also posted on our website. So if you can't remember such a long link, you can go to our website in social determinants and click right on it.
Yep. And we will be sending out additional email reminders about the deadline and to apply. And next slide, I think that's it. There's all of the ways that you can get in touch with us, but we so appreciate everyone's time today. For those of you that are part of the PAC coaching call that is held at this time, please stay on. If you aren't, then thank you, and we hope to see you apply and be part of the Social Determinants of Health initiative.